Hi, this QD video is brought to you by RoomNow.live. I'm Dr. Jack Cush from RoomNow.com. This case is called Bugs versus Crystals. So, a 55-year-old man shows up in clinic last week. I've actually seen him 3 or 4 times before. He's come in with complaints of episodic joint pain, sometimes with swelling. He takes over-the-counter naproxen, seems to get better. But I don't see much on exam. He doesn't really have anything. He has no history of arthritis or gout. I do labs on him. Everything's normal. No acute phase reactants. Normal uric acid. He's got nothing to show, so I'm not really doing any x-rays. And now on his 4th or 5th visit, he shows up with, boom, a right knee effusion that is hot and painful, and he can't step on it. And it's like, dude, that looks bad. And he says, yeah, I know, that's why I'm here. So what did we do? Well, the real problem here is that the knee that's swollen is also a knee that has an arthroplasty in there. He had right knee arthroplasty about 7 or 8 years ago. He said this happened once before, and the orthopedist drained the fluid. And I said, I need that fluid to know what's going on, to know what to do with you, but you need to go back to your orthopedist and have them draw the fluid out. And that's exactly what happened. In the meantime, while we're waiting for that to happen, which took about 2 or 3 days for that to happen, we got x-rays. And because he had complaints before in his shoulder and his hands, and now the knee, we did x-rays of all those spots and found, guess what? Chondrocalcinosis in the shoulder, in the meniscus, and now also in the triangular fibrocartilage of the wrist, suggesting strongly that he has calcium pyrophosphate deposition disease and most likely is going to have pseudo-gout in that knee. So the orthopedist sticks a needle in. He says he gets back a lot of scary-looking, mucky, opaque synovial fluid that he was sure was septic. And he sent it off for culture, and now 4 days later, it's not growing anything, but the cell count came back at 65,000 with 89% polys. He sent off some other special test looking at defensin levels and whatnot, suggesting it might also be infection. Wants to know, what do I want to do? So the question is, does he have septic arthritis with 65,000 white count? Or does he have a crystal-induced arthropathy? You want to know, of course, what did polarized microscopy show? He didn't do it. So when it's too late, that fluid's down the drain. I think at this point, you got to make a decision, and my decision, along with his, was to treat both. My approach is give him a course of prednisone, whatever you want to do, intramuscular or, a Medrol dose pack, something to take care of the acute crystal-induced arthritis, monarthritis, and then give him antibiotics. So he got 25 milligrams for a few days, 20, 15, 10, 5 off. And while he's doing that, he's also taking Augmentin. The orthopedist wants to put him in the hospital and lavage it and get ID involved, and patient doesn't want to do that. So we'll see what happens. But I think that, the point of this case is you can have both. It's not uncommon for an acute crystal arthropathy to present with a septic joint at the same time. And you have to always be aware of that or be wary of that. I think if this patient doesn't do well, then it'll be in the hospital. Why is the patient not in the hospital? Patient looks great. The patient has a normal white count. The patient is afebrile. It's just this right knee that's really bad. So yeah, I think you could make a case for putting the patient in the hospital. The patient said, we'll try it as an outpatient. I said, that's fine. We'll see how you do through the weekend. I guess I'll let you know at a later date. At another QD video or QD clinic, tune in next week.